Reunification therapy is a specialized form of family therapy designed to address and rectify situations where a child becomes estranged from one parent, often due to the influence or actions of the other parent. This scenario often arises in acrimonious divorces or separations, where one parent may intentionally or unintentionally manipulate a child's perception of the other parent, leading to unwarranted fear, disrespect, or hostility. This is commonly referred to as parental alienation or malicious parent syndrome. Given the complexity and sensitivity of such situations, it becomes imperative to involve a professional who can navigate family dynamics delicately yet effectively. That's where reunification therapy comes into play. Parental alienation and malicious parent syndrome are complex, emotionally charged issues that can have profound effects on the relationship between a child and their alienated parent. Understanding these impacts is crucial to comprehending the necessity and potential benefits of reunification therapy. One of the most immediate and palpable impacts of parental alienation is the emotional distress it causes for both the child and the alienated parent. The child, caught in the crossfire of parental conflict, inevitably experiences feelings of confusion, guilt, and fear. They feel torn between their love for the alienated parent and their loyalty to their other parent, while also suffering from cognitive dissonance because of the negative perceptions being instilled in them. Simultaneously, the alienated parent often feels rejected, helpless, and heartbroken. They are confronted with the painful reality of their child distancing from them, often without understanding the reason behind such behavior. When a child is manipulated into believing negative things about one parent, it severely erodes their trust in that parent. This erosion of trust doesn't happen overnight but is usually a gradual process that leads to a strained relationship or even complete estrangement. The child may start avoiding interactions with the alienated parent, leading to a significant reduction in quality time spent together, further deepening the chasm between them. The effects of parental alienation can spill over into a child's other relationships as well. Children who have experienced parental alienation may develop trust issues, fearing betrayal and abandonment in their relationships. They often struggle with forming healthy attachments or become overly susceptible to manipulation, as they've been conditioned to accept the cognitive dissonance between reality and the narrative transmitted to them by people they love and depend on. Studies have shown that children who experience parental alienation can suffer from long-term psychological effects, including depression, anxiety, and post-traumatic stress disorder. They may also be more likely to experience relationship difficulties and mental health issues in adulthood, often repeating patterns of alienation and estrangement in their own families. In the face of these severe issues, the role of reunification therapy becomes even more vital. It offers a structured, supportive environment where healing can begin, helping to repair the damaged relationship between the child and the alienated parent. It's a process that seeks not just to mend broken bonds, but also to equip the child with the tools they need to navigate relationships healthily and constructively in the future. Reunification therapy follows a systematic approach to gradually restore the relationship between the alienated parent and the child. While the exact steps can vary depending upon the specific circumstances, here is a general overview of how the process typically unfolds. The journey towards rebuilding bonds in reunification therapy begins with a comprehensive assessment. In this critical first step, the therapist arranges individual meetings with all involved parties, both parents and the child. These one-on-one sessions allow the therapist to delve deeper into understanding the family dynamics, measure the depth of alienation, and unearth the underlying issues that have led to the current situation. By doing so, they can formulate a more tailored approach that addresses the unique needs and concerns of each family member, setting the stage for effective intervention. Following the assessment, the therapist undertakes the responsibility of educating the family members about parental alienation and its far-reaching impact on the child's emotional development. This educational phase serves as an eye-opener, enabling the alienating parent to comprehend the potential harm their actions might be causing. Simultaneously, it provides much-needed reassurance to the alienated parent, helping them understand that the strained relationship with their child is not a reflection of their parenting, but rather an outcome of a manipulated environment. The subsequent phase involves therapy sessions that are designed to facilitate open communication within a safe and non-judgmental environment. Initially, the therapist may hold individual sessions with the child and the alienated parent separately. This allows each individual to express their feelings, fears, and expectations freely. As progress is made, the therapist transitions towards conjoint sessions, providing opportunities for the child and the alienated parent to reconnect and gradually rebuild their relationship under professional guidance. Throughout the course of therapy, there is a concerted focus on building essential interpersonal skills among the family members. The therapist works to foster active listening, empathy, and effective communication skills. These skills are not only pivotal for addressing the immediate issues at hand but also serve as valuable tools for the family members to navigate future conflicts constructively. By instilling these skills, the therapist contributes to a healthier and more enduring relationship among the family members. The final step of reunification therapy is not an end but rather the beginning of a new journey. It involves regular follow-ups to ensure that the progress made during therapy is sustained and the renewed bonds continue to strengthen. The therapist monitors the family dynamics, provides ongoing support, and addresses any emerging issues promptly. They may also offer additional resources or exercises to further solidify the relationships within the family, ensuring that the healing continues even after the formal therapy sessions have concluded. Reunification therapy is not just about restoring a parent-child relationship. It's about healing a family, breaking down walls of misunderstanding and hostility and replacing them with bridges of understanding and love. No matter how strained the relationship between the child and parent may have become, with the right guidance, patience, and commitment, those bonds can be restored and even strengthened. The final goal is to give the child the gift of having two loving parents, irrespective of their marital status. For more information about parental alienation, visit www.carlacorelli.com.